Yeah, it's an interesting question because I guess at this point in my career, I think of it all as a career of partnership and service, but it was government technically with public schools and then higher education and nonprofits and then kind of dabbled back again in higher education.
Hmm.
But those are all kind of silos that are working to serve people. Right? So I think trying to stitch some
Yeah.
of them together is an interesting one. I mean, what's changed the most in my life right now is I am working really hard to fundraise for a health organization that, of course, also includes education and community empowerment services, but the health with the big 200-bed hospital that we're running, we're doing specialized surgery, we're doing C-sections for women in a community where that wasn't an option before. It's expensive. And once those USAID hits came through, we had a $1.4 million gap in TB medication, malaria medication, and also, of course, malnutrition, which is a big one. And so things got hard real quick, right, with this new administration.
Hmm.
And you could argue, and I think there's a lot of good arguments that you could say there was too much waste in USAID or too much bureaucracy, or they did some studies where kind of these same seven contractors were getting a lot of it, and people were feeling like in Africa, is not coming to African based organizations. So I think those are all really good critiques, and there was a lot of room for change. But the real cruel aspect of it was that overnight element of it, right? And
Hmm.
soon, whether sooner or later, some of these policy folks who made those decisions are going to start to understand that diseases don't really care about their border at all.
Hmm.
And we'll see some of these impacts longer term. So, I think there's a real scarcity mindset right now, and I like to work more from a place of abundance. Burundi is a great teacher in that as well, with the many economic struggles that the country has faced. It's usually listed as the top or second poorest country in the world, but there's still, so much happening here. But I think there is a real scarcity mindset for leaders, for fundraisers, for doctors that are here working with less equipment, for us figuring out how we were going to get kids malnutrition treatment, and then you slap on top of it these visa bans. I keep waiting for when I come here at some point. Burundians are so kind, but it's like, gosh, if that was me, I might be like, okay, well, you're not coming to my country either. It's just
Yeah.
right. But luckily, Burundians are bigger people than us, right? They're just like,
Yeah.
okay, we're going to keep it open. But we had a young woman who was accepted to Harvard, and long story short, she had turned in her passport about 3 weeks before the ban, got the visa, but then the ban happened. And so literally got her passport back for a full ride from Harvard with the visa in there that was stamped, denied without prejudice. And
Wow.
so why wouldn't we want that young woman in the US? Like, we're lucky to be able to have her
Hmm.
her there. And so she also has not been able to move forward with higher education, and kind of has to deal with the psychological impact of getting a scholarship to Harvard and then being told, hey, where you're from means you can't come here. I don't know. I can only hope and think that we might continue to organize more. I will say, some of the change, one example of a change that I've seen is that there used to be shipping of peanut paste for kids facing severe malnutrition here, and and all around the world. And when that abrupt change happened, of the cutting off of USAID, a really great funder alongside Hope in Canada stood up next to us and is helping us grow peanuts and make our own peanut porridge. And so
Okay.
it's not all gloom and doom, right? Like, I don't want to do the thing where I'm like, oh, it's great that they just like cut off aid to starving kids overnight, and so now we'll all just solve all of it through entrepreneurship. No, that's it's somewhere in the middle probably. But it's really cool to see our farmers at work here getting paid. We are now going to buy those peanuts and make the paste, and so there's a lot of learning on this journey, and we're just 6 months in, but it did break up things in a way where there are some opportunities to say, hey, we're not going to ship peanuts from Georgia. We're going to grow our own and empower people here to hopefully have a longer term solution. So there's the good and the bad in between, but I mean, the
Right.
bottom line is really stressful. We need more money, and the money has real consequences on human lives.
How do you get this message out there? Like, how are we spreading, awareness for what you guys are doing? I mean, you guys are building centers, you guys are bringing opportunity. What does that look like?
Yeah. That's a great question, and I would love to, given your communications prowess, invite you in later for some brainstorming with us. But one thing we're doing, Burundi is a very oral culture, and so we're looking more at sharing over the radio, just health education. So sort of doing some monthly radio shots out. We do have our Instagram, our LinkedIn, and our Facebook. I really want to start a TikTok. I feel like our leader, Deo, is so awesome. And if you just did his life, if you just had him walking around the campus and
Yeah.
talking in 15-second snippets things, like you could get some cool things going. So there's lots of space around that. One of our graduates from Kigutu International Academy and also a graduate from the University of Michigan, originally from Ghana, are interns on our comms team. So I feel like I'm trying to make sure we keep it young and fresh while
Hmm.
also yeah, making sure we hit all the professional notes around things. We do newsletters, but
Yeah.
we're not doing enough, and I'm in charge of it, so I can say that. I'm not criticizing